spirit part of me, because I work for the Lord every day, okay? And I did him, and he gave me a go on that. But, the human mind in me was like, well, let me go do some more research. Okay, so I went and I did the research. I looked at the science. I looked at what a beautiful idea, first of all. Okay, we have got to get away from pharmaceuticals and the structure that we're in. Now, I'm not going to throw that out completely because I still use those every day, but I practice with a lot of old drugs that have been around a long time that people can afford, that I've experienced with, that help people. Okay, but we have got to find a better way. Our system, our healthcare systems are crumbling. COVID has destroyed the healthcare system. We have got to find ways to heal ourselves. Okay, because I don't know what kind of systems we're going to be left with down the line. So I looked at the science and I thought, how beautiful. Okay, simply, I love David Schmidt's story, for one. Okay, love it. Worked for the Navy SEALs. My husband's an Army veteran. That hit home to me. I love that. Okay. And then the fact that he would sit around and think about what kept people alive for thousands of years in the Old Testament. That hit home to me too, because I thought, I've never heard anyone else in the world ever wonder that question that I had, but he had been thinking of that, and he discovered what it was. And then the simple fact that God downloaded him wisdom, and wouldn't it be just like God to say, use light to heal people? So the science is very simple. Okay, you see it, looks like a Band-Aid. It's hypoallergenic adhesive. I've had the question come to me, how many people actually react to that? 1 in 10,000, I think. Now, all natural agents. So, when I went down the natural route, that jives with that. There's no interactions with that. And then the fact that he could target, and the beauty of these patches is that he could target, we all end up with different diseases. Okay, we can call them what we want. We have different genetics and we have different choices. But actually, most of those diseases have the same root cause. Okay, degeneration would be one, toxicity, and inflammation. Okay, and then I would put a nice fourth on that, probably psychological, spiritual trauma internally. Okay, so what he's done with these patches is not only did he actually allow your body to regenerate with the X39, but he's attacked every other root cause of disease that works towards almost any condition. This is why you don't have to really be a doctor to recommend what patches people need. So my top few patches that I left, obviously X39, okay? Because your tissue breaks down. It needs regeneration. Okay, the second one, and I think most doctors will probably agree on this, is Eon. Okay, the inflammation is huge. Inflammation, autoimmune disease, dementia. It's wear and tear on your organs. It's chronic kidney disease. It's the root cause of cancer, actually. Okay, so Eon is probably my second, and then third of all, when I learned about all this natural health, the other thing I learned about is we live in a really toxic environment. It's a really toxic world. We're being killed with not only side effects from medications, but chemicals, stuff in our food, preservatives, stuff in things that we think are healthy for us, in soap and cosmetics. And if you go down that route, it's really actually kind of makes you want to vomit. Okay. So glutathione is probably one that I would say is up there next. Now, my fourth favorite is carnosine. Maybe I would put that higher because what I love about carnosine is that in traditional medicine, we're told there are some conditions that are not reversible. A lot of neurologic conditions we're told are not reversible. We don't have the lady who spoke about her stroke, Parkinson's. If you know anyone with MS, what carnosine is able to do is, you look on the testimonials, people are regenerating that neurologic tissue. That's not possible in my world, where I came from. Now, it isn't God's realm, and this is why God is using us as soldiers to get this information out there. Okay? So that's the beauty of all of this. Now, when I was looking at the information in the studies, I said, okay, the studies are good. I looked at the one where he in regards to internal medicine. He actually measured the protein in the X39, the GHK copper peptide. That he not only does the information where he says it elevates the level 40% in your blood within a week's time. Okay. And then he goes on and does another study where he says within 7 days, actually proves that that elevation caused this much improvement in symptoms and mental clarity, peace, and energy. So he just proved not only what he said it would do, but then symptomatically what it does do for people. Okay. So what I want to encourage you to do, and I'm not a business person. I'm not here going to speak to you about the business aspect, but I'm here to speak to you to tell you that, listen, I don't know anything. I've been doing medicine. As I told you, I came down to Galveston in 2002. I've been in practice for 20 years. I don't know anything else. And I'm well versed in alternative therapies, which is my natural route of my studies. I looked at many of those different things. I have lots of friends that are chiropractors. I have lots of friends that are therapists. I have lots of friends that do alternative stuff and solutions and potions and all that. And I don't discount anything. But I don't know anything like this product out there that can do what he says it can do. It's affordable. There are no side effects. And I can tell you this, I mean, I have some patients that spend $300 a month on one prescription for insulin. She was told 20 years ago she needed a knee replacement. She does not want a knee replacement, the complications of surgery and blood clots and all that. So she's just toughed it out. So I gave her the X39 patch and the Aeon patch, and within 6 days, she called me. She said, Tristan, she said, I have no more pain. And she said, the funny thing is, I can bend that knee full range of motion, and I have not been able to do that in years, in 6 days. I have an open-minded cousin in Arizona who's dealt with bad sciatica and carpal tunnel. Carpal tunnel is so bad she was icing her hands in water at night just to get rid of the pain. I called her. I said, you got nothing to lose, Suzanne. 3 weeks, sciatica, carpal tunnel was gone. Her husband is a construction worker who seriously wrenched his hip in a horrible construction accident years ago. He ended up with a hip replacement in like his upper 20s, which is rare to be so young. Pushes himself through work because he still does construction work every single day. Within 1 month's time, he had X39 and I believe X49, and he was pain-free. He's still pain-free to this day. He then went on and ordered the energy patches, and he will not work 1 day of construction work without wearing that energy patch every single day. So I started to see enough in my family and friends that I started to incorporate it with patients, okay? And probably a couple of really great examples of that I have some solidified evidence of. I had somebody with really serious abdominal pain in July, elevated liver enzymes, very high inflammatory markers. You can actually measure that in the blood. It's called sedimentation rate, or CRP. That should normally be like 2 to 3 in someone. This person was 20. They were really high. They did not feel good. So I put them on a series of different patches, including glutathione. Within 2 weeks, I had them back. Their pain was gone. I redid blood work. Their liver enzymes were down, almost normalized, and that CRP had dropped from 20 to 8. I had 2 weeks later, that person back feeling good now. Liver enzymes normal, and the CRP was now down to 3. It was normal. That was in 1 month. And this person was seriously ill. A chronic fatigue, chronic fibromyalgia patient. I've been working with her before LifeWave for a year from everything that I knew, from traditional medicine to the natural stuff that I could incorporate with her. And we made about 10% headway, a little bit. Enough frustrating. And then, so a few months ago, I just said, Gina, I said, give this a try. So she tries the patches. I just had her back a couple of weeks ago, and I have the documented evidence to say, and she came in and she looked at me, she smiled, she's full of life. I have more energy than I've had in years, and she said, my pain is almost all gone. I got her results back the next day. I was shocked, actually. She had 35 CRP. It came down to 7.